Assalamu alaikum students, welcome back to Therapy Kingdom. Today we are going to explore Bruxism. So without any further delay, let's start the video. Bruxism is a condition where a person clenches, grinds and gnashes their teeth, which can happen while awake or asleep. It's repeated activity of the facial or chewing muscles that involve rhythmic contraction of the masseter muscles. Bruxism can be mild or more forceful, and it may or may not be audible. It's most common in children, affecting 15 to 40% of them and 8 to 10% of adults. Bruxism can cause dental damage, headache, jaw pain, and other issues. In several cases, it can lead to restricted the motion of the temporomandibular joint. What are the main causes of bruxism? Psychosocial factor: stress, mood, distress, nervousness, and feeling blue. Second, a person's gene: consuming alcohol or caffeine, smoking, medications. Certain medicines used to treat depression, seizures, and attention deficit, hyperactivity disorder, ADHD, may increase the chance of having bruxism. What is the difference between grinding and bruxism? Bruxism can happen when you are awake or asleep. The grinding action is the same, but awake and sleep bruxism is two separate conditions. Awake bruxism: if you only brux, grind, or clench during waking hours, you might not need treatment, especially if you can find ways to increase your awareness and reduce stress. How do I stop my bruxism? First, lifestyle and home remedies. Second, reduce stress. Taking a warm bath or exercising can help you relax and may reduce your risk of developing bruxism. Avoid eating late in the evening. Practice good sleeping habits. Schedule regular dental exams. What age is bruxing most common? Children who brux usually begin at 4 to 8 years of age. The numbers increase between 10 to 14 years of age and then start declining after age 14. What deficiency causes bruxism? Binary logistic regression showed that sleep bruxism was significantly associated with vitamin D deficiency. Can bruxism be cured naturally? There isn't a cure for bruxism, although it may be possible to break the teeth grinding habits by trying habit reversal techniques. For those with a non stress relative problem, you can speak to your GP about cognitive behavioral therapy, which may help treat any underlying stress or anxiety. What are the disadvantages of grinding teeth? Teeth grinding puts a lot of pressure and stress on your jaws and the surrounding muscles. This pressure usually causes pain and stiffness in your jaws, but it can also cause headache, toothache, neck and shoulder pain, and even earache if you don't address your teeth grinding habits. What is the root cause of bruxism? What causes bruxism? While the exact cause of bruxism isn't fully understood, it's commonly associated with factors like stress, abnormal bite alignment, anxiety, certain medications, drug abuse, and existing conditions like Parkinson's disease and temporomandibular joint disorder. What personality type is a person with bruxism? Self-reported bruxism is significantly associated to several personality traits, mainly neuroticism and extroversion, and to the level of dental anxiety. How to relax your jaws at night? You can try identifying stressors, practicing jaw awareness, improving your sleep environment, using a mouth guard, doing jaw exercises, and staying hydrated. How to relax masseter muscles naturally? Self massage. Gently rub the muscle with your fingertips or knuckles in small circular motions. Applying pressure. Apply consistent pressure directly to the masseter trigger points for a few seconds. Circular massaging. After applying pressure, further alleviate tension by massaging the area in small circular motion. So that's it for today's video. Thanks for being the part of the therapy kingdom. I'll see you in the next one. Don't forget to comment, share and subscribe for more content.